Yeah, so there are a huge amount of options. So ablation just means a way to destroy tissue.
Mm-hmm.
And that can be through any different type of energy source. So it can be cryotherapy or freezing the prostate. It can be using laser, which is essentially a light to generate heat. There is HIFU, which is high intensity focused ultrasound, which is using really focused ultrasound beams to be able to generate heat and destroy tissue. There is photodynamic therapy, which uses essentially you get an infusion of a medication, and then when you apply light to the area where it's been infused, it causes blood clots and prevents it from receiving blood flow, and the tissue dies that way. There is irreversible electroporation or application of an electrical current across tissue to destroy cells. There is planar ultrasound or transurethral ultrasound, which is also known as TULSA Pro. You have microwave ablation, you have water vapor ablation, and there's a number of other technologies that are in development as well. If I focus down on, I would say probably the two most common and most widely available energy sources are going to be cryotherapy to freeze the prostate, or high intensity focused ultrasound or HIFU to focus ultrasound waves to the prostate cancer and destroy the prostate tissue that way. With cryotherapy, it essentially you put a needle through the skin below the scrotum, which goes directly into the prostate, and it's all done under ultrasound guidance, similar to how a prostate biopsy is done. And then you freeze the prostate, and at the end of it, you see an ice ball that grows where the prostate is, and you want that ice ball to completely cover the area where the prostate cancer is. And we do that twice. We call that 2 freeze-thaw cycles. We freeze it, and then we let the ice melt. We freeze it again, and we let the ice melt, and then we're done. There isn't a huge amount of preparation for these procedures. Men will oftentimes just require an enema, and that's pretty much it. With HIFU, how it works is it uses the ultrasound beams that are focused down into a very, very small point, about the size of a grain of rice. And we apply that grain of rice next to each other across the entire area that we want to treat, and it destroys it with a thermal-based treatment or generates heat to a very high temperature, which destroys the tissue that way.